Okay, people are still coming in, but we'll make a start to ensure we don't run out of time. So again, for those of you who just joined, welcome to today's webinar. My name is Matt Reed. I am the head of corporate here at Medigold. I'm delighted to be hosting today's webinar, From Periods to Menopause, Understanding the Impact of Female Health Issues in the Workplace. Before we get started and introduce, more importantly, our expert panel for today, we'll just go through some housekeeping. So again, if this is not your first webinar, then none of this will come as a surprise. Mark, just want to put the slides on one, please, if you can. Great. So for any of you, this is your first webinar with Medigold. The session is going to be recorded. We do not send out copies of the presentation slides from today, but what we will do is the recording of this webinar will be uploaded to our YouTube channel. And following the session, we'll send out a link which allows you to access that and any other series of webinars that we've delivered. And obviously from there, you can feel free to share those with any team members and or access them at a time that works for you. Now, we do have nearly 350 people attending on the webinar today so far, and that's continuing to rise. So don't worry, you're not going to be visible. So feel free, sit back, and as it says, eat your lunch if you fancy, so nobody's going to pick on you if you do. But similarly, we don't have the ability for you to ask questions through the webinar as we go. However, there is a Q&A functionality on your Zoom. So if you click on the Q&A button on the bottom of the session, ask a question. Dependent on time, we will spend as much time as we can answering those questions, or should I say we, rather the expert panel will do that, and we'll do our best to answer them depending on the time. We do have a number of questions that we'll run through for people that have sent those in previously, but let's see how quickly we can get through this, and then we'll come back to the questions, which is always the exciting part. Great. Mark, do you want to move it on a slide? So this is our panel. I will allow them to introduce themselves and then we'll make a start. Nicky.
Thanks, Matt. Hi, I'm Nicky Piper. I'm the Chief Nursing Officer here at Medigold Health. And I'm a specialist in occupational health, but I'm also very interested in women's health issues. So I've come from a family planning background. So this is kind of why I think this topic today is really, really important. Hayley.
Thank you. Good afternoon, everyone. My name is Hayley Betteridge. I'm one of the Associate Directors of Nursing at Medigold. I've got an extensive background in women's health, worked for many years on gynae wards in the hospital. So yeah, delighted to be here to chat to you all today.
Good afternoon, everyone. My name's Susan Stirling. I'm one of the nurse managers here at Medigold Health. I've been specialising in occupational health for around 8 years. I do have some personal experience of gynecological issues, and I think it should be at the forefront of the agenda for people in the workplace and to raise, acceptance and acknowledgement and support. So it's personal to me as well, so, and all us women.
Okay, thanks. So what we're going to try and cover today, are all the topics that are attached here. So we're going to try and just give you a bit of an overview of endometriosis, adenomyosis, PCOS, fibroids, PMDD, menstruation and the workplace, a little look at fertility and the importance of sleep. And we're going to then try and look at the impact on individuals within the workplace, and also look at what the workplace can try and do to help support you, as well as try and give you some tips on how you can manage some of the symptoms that you have to live with if you experience any of the above. Thanks, Mark.
Okay.
Hayley?
So women's health. Can you hear me okay? Women's health at work significantly impacts on work in a range of ways. So productivity, whether that be attendance at work, cramps, fatigue, can affect concentration and focus. Some of the more severe and chronic conditions can cause severe pain that needs, time off work, sickness absence, recovery from surgery, those sorts of things. Sadly, there is often a lack of workplace support for women's health. Some women find it difficult to talk about some of the symptoms with their employers. They can be quite sensitive, or embarrassing symptoms. Only 16% of employers actually have a policy for menstruation, and we don't see a great deal of policies for menopause, for example, and that's something that we definitely want to raise awareness going forward. I'll let you read the stats there in your own time. Thank you.
Just to kind of cover whilst you're reading those, we've not put a huge amount into today's presentation about the menopause, because I think it's one topic by itself, to be fair, and we have done some webinars on that. We are happy to try and answer any questions you may have specifically in regards to menopause, and we have had a couple sent through up front already, so don't feel afraid you can't offer, but we didn't want to make it the feature because it often gets its own feature, so we thought we'd look at some of the less common but still quite frequent. Okay, as I said, we're going to look at quite a few different kind of aspects of women's health today, and these are very common occurrences, but probably not as well talked about as Hayley said, and Sue. And I think it's really important that we kind of just bring to life some of the kind of challenges that these various conditions actually have. So heavy periods affect 1 in 3 women. So that is a huge percentage of the populace that have heavy periods, often that come along with pain as well. 1 in 10 women experience endometriosis and adenomyosis, and we will go into more about those conditions if you've never heard of them. It's about education as well. PCOS, polycystic ovary syndrome. Sorry, my teeth have obviously gone wrong whilst I've been waiting. Affects 1 in 10 women and is linked to changes in mood, fatigue, and lots of other physical symptoms that people may not always expect. PMDD, premenstrual dysmorphic disorder. It's again is a very severe level of premenstrual stress, and that affects up to 1 in 20 women. Maybe I'll start again. Fibroids, again, it affects 70% of women up to the age of 50. The good news about fibroids, if we can pull something positive, is once you enter into the menopause, fibroids cease to be a problem because they're fed on hormones. But we will talk about that a little bit more. Fertility is both physically and emotionally taxing, and is often hidden because people don't necessarily want to talk and share about fertility challenges that they may be experiencing. And up to 80% of women experience symptoms of the menopause and the perimenopause, and 1 in 4 experience severe symptoms, which impacts on their ability to attend work. So really high statistics around all of those different conditions which impact quite severely on individuals. Thanks, Mark.
Thank you, Nicky. Yeah, and as Nicky quite rightly suggests, a lot of these conditions you will find during the presentation, the signs and symptoms can cross over. A lot of people will experience similar symptoms and may require, similar reasonable adjustments or considerations in the workplace. And we will discuss this later in the presentation about specific areas of consideration to support employees who experience these types of conditions. We will lightly touch upon each of these conditions and just talk about what they are for learning and knowledge. Some of these conditions are getting better recognition, more laterally the menopause we've spoken about separately, but things like endometriosis and adenomyosis. So endometriosis is a long-term condition where the tissue or the cells in the lining of the uterus grow in other parts of the body. Commonly, it can affect the ovaries, the fallopian tubes, and the pelvic area, but it can also, you know, disseminate, infect the bladder, the bowels, and can grow out with that kind of pelvic cavity as well. So symptoms occur for people when the tissues break down and when they bleed during their period, but they can't leave the body. They can include severe period pain that can stop normal activities, but that can include work activity, heavy periods, pain and discomfort when toileting, things like that. Okay. Other symptoms can happen at any time during the menstrual cycle. So that can also include pelvic pain in the lower tummy or the back, fatigue, pain during or after sex, and it affects people's mental health, so low mood and anxiety. Next slide, please. So this is the second most common gynecological condition in the UK, and it can take quite a long time for people to receive a diagnosis, between 8 and 10 years. 8 years and 10 months, sorry. Predominantly that can be because people just put up with the symptoms. They may think that it's normal to have that level of pain or discomfort or bleeding. You may be wondering what the first gynecological common condition is, and that's simply menstruation in itself, and we'll talk about that. There isn't any cure for endometriosis, but there is treatment plans available dependent on the staging of the disease, okay? So things like surgery, hormone treatments, pain relief. 55% of people with endometriosis have had to have time off work because of it in the severe disease, okay? 40% of those people with endometriosis worry about losing their job. And 27% of people with endometriosis say that they've missed out on promotion due to the impact of their condition. And sometimes, you know, it's difficult they feel stigmas attached, and they maybe don't want to disclose these conditions. And we will talk about that later when we talk about adjustments. Thank you. Next slide, please.
PCOS. So PCOS is me. I just apologise. I think my video is lagging. I've just seen the comments, so I'm so sorry if you can't hear me. But PCOS is polycystic ovary syndrome. So this is a condition which affects one or both ovaries, where the ovaries become cystic. So they have lots of follicles ready to produce eggs, which sometimes can expand and turn into cysts. Symptoms include irregular periods. Many people with PCOS have excess body hair or very dark hair sort of on their face and body. It can affect the skin. It can cause acne because of the hormonal changes. There's a great deal of hormonal imbalances involved in PCOS, and that can lead to fertility problems as well, weight gain and insulin resistance. Insulin resistance is a side effect of type 2 diabetes, and quite often the treatments for PCOS can include diabetes medication, which kind of helps to regulate that insulin resistance that people suffer with PCOS. Other treatments include sort of lifestyle changes, weight loss, exercise, and obviously fertility treatments if fertility becomes an issue. Thank you, Matt.
Thanks, Matt. So the next condition that I'm going to discuss today is adenomyosis. So this is probably not even as well acknowledged nowadays as endometriosis, and it's quite difficult to be diagnosed as a lot of the similar symptoms presenting in patients. So this is also a chronic condition where the lining of the womb starts to grow into the muscle wall of the womb, and it forms kind of nest clusters. So symptoms of this condition can include heavy and prolonged menstrual bleeding, dysmenorrhea with severe cramps and pain during menstruation. The uterus can become enlarged, causing abdominal swelling and further discomfort. People can have spotting between their periods or a dragging or heavy sensation in the womb. This chronic pain can become located in the middle of the pelvis. They can also have pain after sex. They can develop anemia and things like hormonal migraines. So, but not everyone experiences symptoms, of the condition, but it affects about 1 in 10 women who menstruate. But as I said, it is a relatively unknown condition. 77% of the general public have never heard of it. So endometriosis has got greater awareness now, and adenomyosis is coming behind that now. It's becoming more recognised and people are getting diagnosed, you know, there's more knowledge behind it. But again, diagnosis can take a long time. It can involve multiple assessments, physical examinations and scans. And because a lot of these conditions overlap with symptoms, it's hard to get a differential diagnosis, which leads to the time impact, okay? So treatments can include hormonal treatments, things like the coil, contraception, medication to help with the heavy bleeding, to, you know, induce clotting, anti-inflammatory drugs for pain relief, and in some occasions, surgery, okay? So adenomyosis is slightly different from endometriosis, but again, affecting with all those symptoms. Next slide, please.
Fibroids. So fibroids are non-cancerous growths in or around the womb. So not always within the uterus. Sometimes they can be attached to the uterus on the outside. They cause all sorts of symptoms, to be honest, heavy, chronic, long-term bleeding, pelvic pain, fatigue, frequent urination because of the size of the fibroids pressing on the bladder. They can be, you can have multiple fibroids. They can be from the size of a pea right up to, you know, a large watermelon size. They can be absolutely massive. It affects 1 to 4 people of reproductive age. The good thing is, as Nicky pointed out, once the hormones have kind of reduced, the estrogens reduced after menopause, the fibroids do tend to shrink. Other treatment options, I mean, if they're particularly problematic, somebody might require surgery, you know, full hysterectomy in some circumstances, embolization, where they, you know, specifically target the blood flow to the fibroids in order to shrink them, and hormonal medications as well. Thanks, Matt. PMDD is me as well. So PMDD, another kind of confusing letters, if you like. So premenstrual dysphoric disorder. Now, you've probably all heard of PMS. So this is a severe and chronic PMS, you know, elevated to another level. So the symptoms cause severe physical and emotional anger, mood swings, and typically it occurs sort of 1 to 2 weeks before menstruation in the luteal phase of the hormonal changes. So after ovulation, the progesterone increases to prepare the womb lining for, you know, to take an embryo, and that's where the problems occur for people with PMDD. It can be really debilitating, as well as the sort of emotional side of the symptoms. People can experience joint, muscle pain, fatigue. You know, in some cases, they are unable to sort of get out of bed and function. Similar sort of symptoms and similar treatments, hormonal treatments, sometimes SSRI, so antidepressant medication, can be prescribed to help level out some of those psychological symptoms, and obviously pain relief as well. Thank you, Matt.
I suppose in some respects, Hayley, it can have very similar symptoms to the menopause itself, can't it? Because it's got the same kind of combinations of impact, I guess.
Yeah.
Next slide, please.
We're definitely hearing more about PMDD now. And
yeah,
I think the difficulty lies therein that what we're saying is so many of these symptoms are coexisting in different conditions, and patients will maybe put up with them, or employees, people maybe don't go to the GP, and it's getting that differential diagnosis, which can be a timeless process, you know, for the different conditions. So the next thing that we're going to speak about is menstruation and the workplace, okay? So menstruation, which we all know as a period, is the natural biological process where the body sheds the lining of the uterus, the endometrium, typically once a month. That can be variable from person to person as part of that menstrual cycle. Some people can have longer or shorter periods. Some people can have heavy bleeding without having a pre-existing gynecological condition. Okay, so almost 4 in 5 women have experienced menstruation symptoms, with the most common being abdominal cramps, about 60% of people. Irritability, and again, that would be linked in with the hormonal changes that occur during that cycle, okay? So 52%. Fatigue, again, that could be just due to varying hormones. It could be due to blood loss and things like that, so 49% there. 49% of women experiencing bloating, and 47% reported experiencing particularly low mood around that time, okay? As we've spoken about previously, 15% of women have a menstrual condition or a gynecological condition out with a normal cyclical process. So things like endometriosis, adenomyosis, fibroids, PCOS or PMDD. More than 2/3 have experienced a negative impact at work due to their symptoms, and 7% of people feel they have been discriminated at work because of menstrual symptoms, and more than 1 in 10 say their menstrual symptoms have had a negative impact on their career progression, okay? So I think it's important that we protect employees against stigma and discrimination, and that, you know, we're going to talk about that when we talk about reasonable adjustments, okay? But that's the kind of natural process for people who experience a cycle. Next slide, please.
So fertility issues sadly affect around 1 in 7 couples in the UK. There are many reasons why somebody could be struggling to conceive a pregnancy. I think what is overlooked is the kind of mental health side effects that come with often, you know, it's an emotional roller coaster for a couple. Yeah. They cycle through hope, and then there's disappointment, and you know it's never straightforward. Also the financial strain is a huge financial strain, which brings, you know, stress with it as well. A lot of the medications are brutal. You know, they have to be taken at certain times of the day. They can really disrupt normal routines. They need to be kept, you know, in the fridge. They're injectable medications, which people, you know, wouldn't be used to sort of taking. It is a huge issue. People may not want to discuss it with their employer. There's a lot of evidence to suggest that they feel, you know, overlooked for job promotion, or they feel they might be treated unfavorably, you know, because they sort of have a pending pregnancy, which I think is really sad, and something which, you know, certainly there should be policies in place to try and support individuals that are going through fertility treatment whilst trying to work as well. Thank you.
We just also wanted, although it's not specifically female related, but sleep has a massive cross impact on all of the conditions that we've talked around. And sleep deprivation has a huge issue both physically and mentally on an individual. So we just wanted to kind of bring a bit about sleep into the equation anyway. Women do tend to sleep less than men as a rule. I know that's a bit of a generalization, but it is a true one. And obviously, if you're experiencing any of the conditions that we've talked about previously, it does impact on your sleep, particularly if you've got heavy periods. It often wakes you up in the middle of the night because you've got to go to the toilet, and lots of things like that. So you get a lot of interrupted sleep, and also it's a lack of good quality sleep, because we can all nap, but actually we need some REM sleep to really give us the impact of recovery, and having to get up to go to the loo on a number of occasions during a night's sleep has the impact on your REM sleep, which then leaves you feeling exhausted, fatigued, difficulty with concentration, reduces your resilience because you're constantly feeling tired and exhausted, and it has physical impacts as well on your heart, your blood sugars, because your body is all out of normal general sync. So it's really important not to underestimate the impact of sleep. There are some things that we can do to try and improve our sleep. And there, we will incorporate a top tips leaflet that we did around improving sleep, whether it's due to menopause or any of the other things we've talked about, or just due to laying there worrying about stuff. Then sleep, is a real kind of fundamental part of the whole jigsaw, really. So really good if you can keep some level of good functioning REM sleep, then that will help with all the other symptoms or other challenges that you may well have in a day. I think the important thing about good sleep hygiene, as they call it, doesn't necessarily mean you have to have a shower before you go to bed. It's about kind of getting your body into a conditioning phase. So it's really important, if you are struggling with your sleep generally, to stick to a regular sleep pattern. So go to bed at normal times. Just because you're not feeling tired, don't think I'll sit up a bit longer, because this all starts to take your circadian rhythms out of sync. So stick to a regular sleep pattern, going to bed at regular times, giving your body time to relax. Obviously avoiding the electronic gadgets, which is a common theme for most people these days. They go to bed with their phone, their iPad, their laptops. Ideally, you shouldn't use those kind of things within an hour of going to bed, to give your brain time to relax and empty. Obviously, you could put your calming app on, but you shouldn't be looking at those screens. But you can use those kind of relaxation techniques to help with get your head clear and get you to relax. Make the bedroom the sanctuary. Try not to watch TV in the bedroom, because that's a stimulus. Make that your sanctuary for rest, relaxation, quiet time. Get blackout curtains if you struggle with daylight, to give that warm, cozy feeling, so that you go to bed to go to sleep and get that quality. Limit your caffeine and alcohol before bed, because they have a really bad habit of interfering with our sleep quality, although we've probably had fun just prior to that, drinking them or taking them, but they do have a real impact on our ability to relax and kind of get into that sleep mode. Keep your bedroom dark and reasonably cool, not too hot, not too cold. Will certainly help with your regulation of your body temperature. Some people like a cold bedroom, so they can pull up that nice duvet and get themselves snuggled. Whatever works for you is a really good thing to do. Other things you can do just to keep your body kind of ticking over normally, and will help with some of the symptoms of all the other things, the other conditions we've talked about, is regular exercise. So taking regular exercise is really good for those positive endorphins. So it's going to help and impact on that positive mindset, particularly if you're struggling with a number of different things. Try and manage your stress. I know that's often easier said than done, but even if you can just try and use some relaxation techniques before you get into that, that mode of sleep, keep a little notepad and next to the bed. So if you think of something in the middle of the night, rather than let it impact on your mind, pop it into the book, even though it might be rubbish when you read it in the morning. It will take it psychologically out of your head and put it somewhere safe, so then you can forget about it. So a few things that you can do for yourself. Get some morning sunlight. Sunlight's a really good thing to set you up for a good day. Don't do it at night, of course, because you're needing to wind yourself down and pop yourself into that darker zone. But it's all about getting that good combination of things just to help enhance your sleep. Yep, if you're having a really heavy period, whatever you do, it's not going to change the sleep pattern. But when you can have a good night's sleep, try and follow some really good processes to get yourself and your body prepared for that rest that you need. Rest gives you good resilience as well. So if you've got an infection, you'll be able to fight that infection better. So really good positive things to focus on, really. Thanks. So we also then thought we'd look at the impact that some of these conditions have on women and work. We appreciate that you know, we've talked about some of these things already, but I think it is very underestimated that, you know, some of the symptoms that people are experiencing does have a huge impact on their ability to attend work. And I think that has a knock-on effect on stress levels, because they're fearful that if they can't attend work, their sickness absence is going to be monitored and they're going to end up losing their job. So it kind of combines all of these emotional challenges together, never mind the symptoms of the illness itself. So, you know, the pain, the discomfort, the irregularity of periods in some people will impact on how they feel per day. People go through cyclical things as well, where they have some heavy periods for a given period of time, and then they have a few normal months, and then the heavy periods come back again, all of which impact then on their sleep, their stress levels, and their ability to be able to kind of be strong and resilient, which is what is expected within the workplace, because when you're at work, you're expected to be able to stand up and deliver what you need to deliver from your job. People are embarrassed about it, and often, as Sue said, I think when she was talking about a couple of the conditions, about talking about it, and one of the that's really important is to be able to talk about it, because if you don't, your manager will never know, and then you'll kind of continue to fight this kind of should I tell them, shouldn't I tell them, is it going to impact on my career, is it going to impact on my future? But actually being able to talk about it is a really positive thing, both psychologically and to help the workplace understand. We'll go into some adjustments shortly. There was one study that was quite shocking, to be honest, where 80% of women felt less productive due to period symptoms for over 23 days per year. That's almost 1 month's worth of work, which, you know, that's a massive impact on someone, and certainly with some rigorous sickness absence policies could have quite a big impact on them. So, you know, that is huge. And as Hayley said about the fertility side of things, again, people are embarrassed because they can't conceive naturally. So again, don't talk about it and try to manage it within themselves, which again builds up this kind of real pressure pot. So lots of impacts that, you know, all of the things can have on an individual and on their ability to attend work on a regular basis. Thank you. So again, some of the things that I was just talking about really on why women struggle to access support. They worry that they'll be judged if they talk about it. There's still a lack of understanding in a number of organisations where they haven't looked at policies for women health challenges. So they're afraid to bring it up. They don't want to be the first to talk about it. Only 12% of organisations offer support for menstrual health, and just 27% of employers even currently have a fertility policy in place, which is really, really small. And as I said,
someone's just mentioned in the chat there, which is really nice to see, that they've implemented a fertility policy with a paid time off for appointments. Amazing.
Excellent.
Yeah, that's obviously a very modern, forward-thinking organisation, because it is all of these things. Nobody wants to cause a fuss, do they? Nobody wants to kind of be the first to put their hand up. But where organisations are now looking at bringing in menopause, or, you know, as we say, any of the kind of policies, or give it a generic policy of menstrual health even, you know, that's a really kind of key move in the right direction to help support and make this more kind of part of the conversation. Thanks, Matt. So we did pull together a little bit on what employers can do. Obviously, it's down to each organisation to have this conversation, but, you know, it's good to try and champion these things within your organisations. It's about sometimes a bit of manager training to make them feel confident to talk about difficult subjects. It shouldn't be a difficult subject, but it's a sensitive subject, and some people don't feel that they've got the right skills mix to be able to talk about that. So it's really good to look at doing some manager training to have those sensitive conversations. People often feel comfortable talking to a fellow woman if they've got some of these issues, but it shouldn't have to be like that. You should be able to talk to anybody about those challenges and get the right level of support that you need. Really good to perhaps have champions in the workplace, and I know some organisations do have champions for a whole host of conditions, including neurodiversity, as you know, menopause, any of the kind of real key topics. So really good to set up a bit of a champion, set up a little network within the workplace for people to kind of give each other a little bit of moral support, obviously in a confidential space as well. You know, sort of certainly include and involve females in the mental health first aid, so that, you know, people can speak to like-minded or people who are experiencing similar things themselves. So there's a lot of things that the workplace can do. Flexible working policies. If you've had a night where you've been up and down to the toilet several times, you know, being able to start a bit later on those days will allow you to get that really important bit of REM sleep, so that you come to work feeling a little bit more refreshed. Being able to work from home sometimes, or if you've got to go in the office, because some roles really can't work from home, then being able to have easy access to toileting facilities, some sort of privacy, a shower, or somewhere you could wash if you were to need to, are really helpful things to have strategically placed in your workplace. So at least if you do have an incident where you do flood, period just becomes very heavy, you've got access to kind of take yourself off and have
Nicky,
that.
I think, sorry for interrupting. I'm thinking, you know, it is important to highlight to employers they don't, you know, need to press for medical details with their employees, because it can be such a sensitive, you know, conversation, and maybe focus on the work-related needs. So don't feel, you know, not everyone feels comfortable discussing all of their symptoms. You know, there could be cultural, ethical beliefs there that they may not feel comfortable discussing it at all. So again, getting that information but dealing with it in a sensitive manner. You know, so if you're an employer or you're a manager having that discussion whilst gathering relevant information, you don't need, you know, if someone doesn't want to give the medical ins and outs of signs and symptoms, you know, you have to acknowledge that. Focus on more related to what is the role, what is the work-related need in relation to that. And every individual, I would imagine, would be different, would you think, and what they feel comfortable talking about?
Yeah, absolutely. But everyone has an individual experience as well, don't they, Sue? So, you know, for some it can be, you know, quite difficult all the time, but for others they may well have really heavy periods but don't get the pain attached to it. So like you say, it's a personal experience for every single individual, which is well, we're all individual, I guess. But I think it's about some of the more simplistic things that don't cost anything, and other things that, you know, you can consider for yourself is, if you know this is coming, and, you know, I'll speak from some degree of experience on some of these things. I think, you know, I always used to keep a spare set of clothes tucked away in the bottom of my handbag, or, you know, just small things like that, just to give me that reassurance that if I did have an incident, I could at least get myself back into a reasonable space. But it takes time and experience to think about those things, I think, sometimes, because often, you know, it captures you unaware, doesn't it, the first few times, because you haven't had time to kind of think about it. So I think there are some really simple things that organisations can do and think about, but I think also individually we can think about things that we can pop into, you know, our lives as a routine, to kind of account for any of those occasional days where we get caught a little bit unaware, really. Thanks, Matt.
It's nice to be able to sort of share the experience as well. You know, other people are going through a similar thing. Someone in the comments there has just written that they've set up a cafe, so a menopause cafe, where women can come together and talk about, you know, similar symptoms. maybe get some tips about how to manage.
Yeah. Yeah, I think, you know, that's where, you know, the support groups, setting up support groups in the workplace, you know, it's probably best if you instigate these yourself with the support from HR, your manager, whoever kind of is influential in the workplace, because I think if we can talk about things, we all know that talking is good for us. So if we can start to have those kind of conversations with peers, with managers, then it just helps spread the word and the burden. I think we were asked around, you know, how can we get men involved? And I think it's really important to try and share these experiences, this type of information, get them to read some of the information around the condition rather than just keep it to yourself or your partner. You know, share the information. So it's a shared, you know, it's a shared experience. So if you do have a really bad day and your hormones are all over the place and you kind of feel quite tense and feel like you want to rip somebody's head off, maybe, you know, talking from my own experience,
yeah.
you know, then it's important that they understand why you're feeling like that. And equally, obviously, we have boundaries in the workplace. We can't tear around screaming, shouting, swearing at people. But if people understand that you're going through a bit of a high hormone period or you're having a really bad experience, then they'll probably be more empathetic. They'll probably give you a nice wide space in which you can let go of all that emotion that you need to let go of. But they'll be more empathetic and understanding. So,
Yeah.
you know, I think that a problem shared, as they say, is a problem halved, isn't it?
Yeah. And in the same respect, if you're a manager or an employer and you feel that, you know, an employee who's normally, you know, a dedicated staff member or starts to display, you know, behaviours in the workplace that are maybe out of character, you know, as you mentioned, Nicky, maybe, you know, having outbursts or a bit more tearful, or it's one of the things that you may want to consider having that, you know, private discussion with them, because it could be something hormonally affecting them, particularly if, you know, it's a change to behaviour. It's always something to consider amongst everything else.
Next slide, I think, is the
Is that
references, isn't it? We've done a reference source here following our kind of presentation of the slides today. So I guess we're now at the point where we're going to go to questions. I did notice there was one question in the text, and I'm just going to answer it as I've got the information around transgender individuals and kind of talk about some of the experiences that they can have during that hormonal transitional stage. Obviously, the uterus is a key form for a lot of the conditions that we've talked about today. Obviously, in a transgender transformation, they won't have a uterus, or if they have, then the hormones they'll be taking will be suppressing the uterus. So they're not going to experience a lot of the things that we talked about where the uterus is involved. However, the hormone transitions can be quite high and quite emotional. So often there's an experience of breast tenderness as breast starts to develop. Skin changes is another real key factor. So skin becomes drier and can become thinner, less oily than it would be normal, which again mirrors part of what happens during the menopause. So there are definitely a lot of crossovers here. Body fat redistributes, so changes in their appearance can become quite prominent and often probably bring into question people asking more questions. So again, really important to try and feel confident or find someone you feel you can be confident with to talk about the kind of transitioning experience that you're going through. Again, changes in body hair, hair reduction, hair increase, depending on which transition you're going through. I think menopausal symptoms, as I said, are very classic because as you go through the perimenopause, your hormones are reducing, and then you go to the menopause and your hormones gradually disappear. But obviously, as you're going through taking hormones to bring on that female structure, then obviously you're going to get the premenstrual tension, the anger, the irritation, the anxiety. So there's a big crossover in those transitioning phases that are equally as important and need to be acknowledged. And support is really key. And it's a bit like being able to talk openly and freely without getting upset and distressed, or not being able to talk at all. So really important to incorporate everyone into those policies.
I think that links in with menstruation generally as well, Nicky, just when you're touching upon that. We have to acknowledge gender identity, and there may be individuals in the workplace and their gender identity maybe doesn't correlate our consideration for general cyclical menstruation, but it is for the, you know, a consideration for them. So just to have that empathy and consideration for all identities as well in relation to that, with what you mentioned when you were speaking about that there.
Yeah. Sorry, there were just a couple of questions I saw pop up as we were talking. I couldn't keep thread, but that's what the lovely Matt's there for, isn't it?
Oh, the lovely Matt, thank you.
There's a good one here, Nicky, about how do you get your GP to take you seriously?
Yeah, I think, you know, that is one of the kind of big challenges, I think, out there. You know, I think, and I can share my own personal experience in here. You know, I had a feeling I was going through the menopause. I'd got very itchy skin, felt quite achy, lots of bits and bobs of symptoms. And my GP asked me if I thought I was depressed. I assured my GP that I really wasn't depressed and that I thought it was more to do with the menopause, and insisted that I wasn't going to leave that room until I'd got HRT treatment. So you do have to be quite strong. You have to be quite firm around your symptoms, what you believe is going on for you. Certainly do some research before you go to the GP, so at least you can be prepared for some of the questions they may ask you. So it is sometimes, and I'm sure Sue, you could probably share, you know, you have to be quite dogmatic about it.
Yeah, you have to be your own advocate, you know, to put it across. And, you know, we all know that, you know, you have a limited platform of opportunity for, you know, appointments nowadays. You can only talk about certain things, but a lot of people experiencing these symptoms have experienced them for a long period of time. And normally they're presenting at a GP for the first time when the symptoms have got to a point where they're not coping, either with heavy bleeding or mood changes, and they know that something's just generally not right, and then they're seeking medical attention. Like you've experienced, Nicky, you're, you know, an experienced clinician, you knew you weren't, you know, depressed, or it was related to the hormonal changes there. So, you know, I think it is difficult to, and that's where it leads to the, you know, the delay sometimes in referral to gynecological services, getting other tests and things done. But I think you need to be your biggest advocate and, you know, be quite clear about what you're experiencing and what you're feeling there. So yeah, absolutely.
And if you don't feel that brave, take someone with you who can be your advocate, because it, you know, it's quite an emotional cycle, isn't it? So sometimes we don't feel strong, we don't feel brave, but take someone with you to the doctors.
Or write your symptoms down, because you often forget when you get in there and you get your opportunity, you forget what you were going to say.
And that kind of relates on to discussions with, you know, your managers in the workplace about types of reasonable adjustments and things that you may require. So it can be quite a, you know, a emotive discussion, particularly if you're feeling, you know, hormonal or tearful or anxious, and you know it's impacting in your work activity. So when you're entering into these discussions, I would suggest that employers and managers are aware that, you know, to have empathy and consideration, and that reasonable adjustments should be considered that are, you know, considered with privacy and dignity for individuals. So thinking about toileting, accessing to toileting. You mentioned, Nicky, about potentially having to change your clothes and things. This is huge for people who experience this, and, you know, not everyone feels comfortable discussing it. But I think in the workplace, it is important that you raise concerns to your line manager or your employer, so that, you know, what type of reasonable adjustments are you needing? You know, can you work from home if you have particularly bad days during your cycle? Do you need amended duties if you have a manual role? They need to look at the risk assessments. Do you have appropriate equipment for DSE? You know, do you have a sore back when you're sitting down? So these are all the types of things that would be done as part of that discussion. But if you don't disclose it to your employer, they're not going to know. So they can't support you. But I think it is important, and it should be addressed in a kind, compassionate way, because, you know, I think we need to be talking about these things more often now.
Yeah, definitely.
Great.
Sorry, Matt, we've flown off on the
No,
questions before you had a chance.
Sorry, Matt.
I'm in no position to interrupt, nor did I want to. It's been a fantastic chat. Thank you very much. I found it really useful myself. We do have a little bit of time left for Q&A, so apologies. We've seen there's a lot of questions that have been asked as we've gone through, and we do have questions that we received beforehand. Obviously, we can't give individual advice on cases. It would be more generic advice, and obviously, we'd always advise you to speak to your GP. Previous comments accepted. So we'll just try and fly through a couple of these. So we're not going to answer them all by any means. So if I start with, let's go to you, Sue, first. What advice and support should be provided to women with irregular or missing periods?
So if it's a pattern that's been displayed for a long period of time and you're maybe, having associated symptoms with that, if you're missing periods, you have to think about reasons for that. So, different conditions can affect your normal cycle. Some women have a regular cycle, some women don't. Is it pregnancy? Is there other hormonal issues? The most important thing I would say with any kind of abnormal patterns or bleeding behaviours or symptoms, as you quite rightly said, Matt, see your GP in the first instance, okay? If you're concerned and it's not normal for you, or there's a change to your cycle, if you're sexually active and you've missed a period, pregnancy test would be the first line management, that type of thing. But certainly get medical advice from your GP to look to see. Some women just don't have a normal cycle, and that's normal for them, if that makes sense. But yeah, back to the GP to get advice if you're concerned.
Great, perfect, thank you. There's quite a few questions around education, or rather lack of it, and this is looking at guidance being readily available for partners, NHS and GPs more widely having access to information, and also what's going to be taught within schools as part of education. I think we kind of touched on that as well. There's also a question around that ability for partners to have access to information, and we do have the reference links that are going to be sent out alongside the recording in the next couple of days, so it'd be worth maybe revisiting some of those with your partner potentially. If we look at some of the questions that we've been asked today, this is a really interesting question.
The chat's really good.
Yeah, absolutely.
Yeah,
I'm struggling to put out questions. Is that many of them?
Everyone.
There was quite a good one. There was quite a good one, Matt, about osteoporosis and sort of, the loss of bone density as you sort of progress through the menopause. That might be worth addressing.
Yeah, absolutely. Have you got access to that? Because I'm going through.
I can do that one actually. Somebody asked about the impact of bone density on during the menopause, to be fair. So during the menopause, obviously bone density comes with your estrogen progesterone mix, and as that starts to deplete through the menopause, your bone density can potentially take a bit of hit. So people become more prone to breaking bones as they get older. So often on a nice slippery day, if you worked in accident and emergency, you'd see lots of older ladies and men who, mainly ladies to be fair, who end up with broken wrists where they've slipped on the ice. Whereas for you and I, with hormones, we probably wouldn't break our wrists. We'd have a few bruises, obviously, because we've fallen over, but they'll usually always break something. So it's really important to try and preserve your bone density. You can do that by eating a good balanced diet with lots of kind of proteins and calcium in, so milks, cheeses, dairy type products, but also using exercise. So they used to always say doing impact exercise, so running, jumping, all that kind of thing. But the theories have changed slightly now, and it's more about lifting weights. And I'm not for 1 minute suggesting that you start becoming a bodybuilder, but by doing some level of weight exercises with dumbbells or cans of beans, they say that this can work to help maintain your bone density a lot kind of more efficiently, as well as kind of you eating the right products. So really important to start thinking about that perimenopausally, and kind of as you work through to that perimenopause time, and then obviously continue and probably increase it slightly to keep that bone density strong, to avoid having those broken bones.
Thanks, Nicky. And just a quick question from Holly. One for you, Hayley. Can you opt to have a hysterectomy if you're suffering with painful conditions, even donate to science, perhaps?
I think that's a difficult question to answer because it's dependent on, the GP and the onwards referrals that are offered. But as Nicky said earlier, you need to be your own advocate. You need to push for, what you need as a woman. And I think that once you've got that onwards referral, those are the discussions to be had with the consultant or, with the team as to what the best options might be. Hysterectomy is often the last resort, let's face it. Usually there's a variety of treatments that are explored prior to that, whether that be hormonal treatments or other types of medication or sort of smaller interventions rather than opting for a hysterectomy. So yeah, certainly one for the the medical team and try and push for an onwards referral is what I would say.
Thanks, Hayley.
They also take age into consideration as well, don't they? They're kind of very reluctant to even contemplate that under the age of kind of 50, really. But as Hayley said, if the symptoms are so bad and impacting so bad, you need to kind of be able to kind of get that across to the doctor to look at what the alternatives are. And if the alternatives aren't working and you've took on board the repercussions, because obviously having a hysterectomy means that you can no longer have children yourself. And that's a big step for some people, particularly as we get older and we choose to have our children later and all of those kind of things. So it is a big decision, but you have to weigh that up against the impact it's having on your life.
Yeah, and I think particularly in relation to work as well, Nicky, isn't it? Because if you do have absenteeism due to kind of gynecological problems and it's cyclically and the people are aware and they are become worried and more stressed about losing their job. So it's like that work-life balance, what is the impact there, like how bad is it, and I think you're right in what you're saying, and then it titrates over into the workplace as well. Yeah.
Thanks, everyone. I think we've got time for probably just one more question. So this is a question sent in anonymously. How do I know if I'm in perimenopause? I struggle with mental health issues which seem to overlap, and my pill means I haven't had a period in many years. So understandably, the person feels a little lost. What's your thoughts, Nicky? To you first.
Yeah, I think the perimenopause creeps up on us, really. And we only kind of start to think when we start to get these odd random symptoms, because you don't necessarily start to get hot flushes straight away. I mean, I can speak from my own experience. I personally started to struggle to put words together, to talk sensibly, put in sentence. Some people may say I still have that, but anyway, to get those kind of sentences and speak publicly like this was really difficult. And then I noticed that I had bits of joint pain, my skin was really itchy. So often it's worth just noting down all of these kind of little anomalies that you're getting. Anxiety certainly came into my life as one of the symptoms, and I'm not someone who's, I'm lucky not to have had that symptom in my life before. So again, that kind of unnerves you. And I think, if you're kind of struggling with your mental health as well, it all kind of gets a bit fudged in. So what I'd suggest is keeping a little diary of all the symptoms that you're having and experiencing, and then maybe looking back over that, taking that with you to the GP and saying, do you know what? I think I might be perimenopausal. I'm of that age, whatever that is. And that usually links into when your mother went into the menopause. So you usually follow a similar kind of line. It's quite difficult because they could do a blood test on you and the blood test won't necessarily show anything, but your actually symptoms are the things that you need to be looking at and working on. So well worth keeping a little diary of all your symptoms. Take that diary with you to see the doctor, talk through the things you've had, talk about your mum if you know when your mum went through the menopause, or maybe your close sisters if you've not got a mum directly, and be able to take a bit of a story with you when you go and talk to the doctor with those types of symptoms.
Brilliant. Thank you.
Yeah, and I just wanted to add, sorry for interrupting, if employees, and it can affect the person mentioned about their mental health and struggling with their mood and their mental health, a lot of employers have like employee assistance programs as well. So if they can reach out for mental health support, if they feel they're struggling, you know, that could be something they could access via the employer, or if they wanted to do a wellness action plan in the workplace to support the mental health in correlation with whether it's menopausal or it's exacerbating a pre-existing mental health concern. So for employers just to have awareness that that might be a supportive measure as well.
Brilliant. Thank you, Susan, Nicky and Hayley, for your time, and thanks everybody for joining us today. That's all we've got time for, I'm afraid, and apologies, there are a whole raft of questions that we don't want to get.
We will answer those, Matt. We'll
answer those over the time to you, for sure. But as we said just before we finish, we'll be sending out a recording of this session to everybody who's registered for the webinar today, so that will be able to be accessed through our YouTube channel. And don't forget the next webinar, which is the 24th, second part of our neurodiversity series. So until then, thanks again for joining. Thanks again to the panel, and we'll see you very, very soon.
Thank you.
Thank you, everyone. Thank you.
Bye-bye.